Hello, and welcome to Team 2's Applied Project presentation. Team 2 consists of Robert Miles, Carlo Vidal, Barry Manuel, and Jack Prowl. Following is an applied project presentation of PCH's senior leadership requesting funding for a telemedicine transformation project. Welcome, board members. We have developed a transformation plan for Phoenix Children's Hospital that will reduce cost, increase customer satisfaction, efficiency, and capacity while providing a healthy return on investment. This recommendation comes as the result of in-depth industry and company analysis. We are recommending a video conferencing telemedicine transformation plan, project code named VCDoc, which aligns with the hospital's strategic goals. We are requesting an initial investment of $310,000 to proceed with the planning, test, and implementation phases of the technology plan. The hospital industry is extremely regulated, as you can see from the diagram. There is significant pressure from federal and state agencies, payers, and others. Intensifying the effect is the fact that 60% of the $860 billion industry revenue is through public insurance programs such as Medicare and Medicaid. Technology is also rapidly changing, which results in improved patient care and process improvements, but increases operating costs. High growth rates are expected to continue, driven by the increased needs of the baby boomer population. The rapidly rising cost of healthcare has brought upon significant regulations, specifically the Patient Protection and Affordable Care Act, or ACA. This legislation is going to be a game changer for the hospital industry and will require significant efficiencies in cost, productivity, customer satisfaction, and safety. This act will also increase the demand in patient population, and hospitals must adapt to face this new challenge. Porter's 5 Forces was leveraged to provide a baseline and understanding of the industry challenges. For example, while high regulation may create significant barriers of entry to newcomers, it has significant implications on operations. Consider the ACA and their initiatives for high quality of care, health care for everyone, and reduced medical cost. Another barrier is the high investments that are required to start a hospital. A very recent example is the opening of Palomar Medical Center in San Diego, which opened a 740,000 square foot facility at a whopping cost of $956 million. These same barriers also create high exit barriers, which results in rivals that are very committed and therefore drive higher competition in the industry. However, the 6% year-to-year growth anticipated in this industry, the low bed per 1,000 population density ratio, and the increase in transparency and price stability as a result of regulation help keep industry rivalry in balance. Buyers have very little bargaining power when it comes to healthcare. However, regulations keep prices in balance, and the hospitals don't have strong bargaining power over payers. Additionally, technological advancement continues to drive cost pressures due to more expensive pharmaceuticals, equipment, or procedures that improve patient quality of care. Therefore, the suppliers continue to maintain their bargaining power, which will impact hospital profitability. It is therefore imperative that our transformation initiative contain a cost reduction strategy. Alternatives to traditional hospitals have surfaced over the years. While recent regulation has stopped the proliferation of doctor-owned practices, substitutes are still abundant in the industry. Outpatient, ancillary, and ambulatory standalone services are all viable substitutes for hospitals. To highlight some key differentiators, the hospital's primary focus is centered on providing specialty and subspecialty pediatric care services that specialize in cancer and blood disorders, neurological, heart, NICU, orthopedics, and trauma services. PCH is the only pediatric hospital providing phase 1 clinical trials for cancer and blood disorders. Other unique services found at PCH within Arizona include a pediatric dialysis facility, a kidney transplant program, and an ACS verified level 1 pediatric trauma center. PCH is heavily involved in research, clinical trials, and projects to help identify new treatments and to evaluate drug and device effectiveness. It has a strategic partnership with Dignity Health and St. Joseph's that combine both respective pediatric neuroscience programs into the Barrow Neurological Institute at Phoenix Children's Hospital. Additionally, through the oversight and regulation of an institutional review board, PCH has partnered in total with over 9 organizations, which include the University of Arizona College of Medicine and the Arizona Mayo Clinic. PCH brand reputation and its specialties have earned it national recognition from the Leapfrog Group as the top children's hospital in 2012. U.S. News ranked PCH nationally in 4 pediatric specialties, including neonatology, nephrology, neurosurgery, and pulmonology. PCH has strong brand power, evident through its numerous specialties and innovative culture. We recommend leveraging these strengths to achieve excellence and differentiate it from others in the industry. The hospital has expanded in the Southwest via acquisitions and partnerships. Such activities reflected in the financial statements and appear favorable. However, looking deeper into the financial statements, we noted a trend of increasing cost and reduced liquidity. In preparation for the impact that ACA will introduce in 2014, PCH needs to continue to focus on cost reductions and efficiencies. Moving on to the external factors, opportunities, and threats. We noted that regulatory pressure and Medicare payment cuts continue to be a threat to the company's profitability. Also, while the ACA mandates healthcare for every U.S. citizen, unemployed citizens are exempt. Therefore, economic decline or increasing job losses will pose a threat to PCH. Opportunities for PCH include the reinstatement of Arizona's children's insurance, known as Kids Care 2, and the pediatric population growth, which is estimated to grow to over 1.5 million by 2030. This is an important consideration as the transformation plan needs to provide increased patient capacity. The hospital's mission is to provide hope, healing, and the best health care for children and their families. Supporting this mission is a strategy for the hospital to be the Southwest leader in pediatric services. It will accomplish this through quality care, cost containment, efficiency improvements, brand reputation, and increased capacity to serve the influx of new patients. The heat map shows a scenario of how PCH can expand its presence throughout the Southwest. Cost containment will continue to be critical while staying abreast of ACA-imposed changes in healthcare. An example is the additional requirements for 501c3 status, such as the Community Health Needs Assessment. The increases in physician workload coupled with healthcare work shortages will challenge all hospitals to maintain their high quality of service standards. Quality-related benchmarks will be a significant driver as they will determine Medicaid reimbursements and other new sources of revenue offered through ACA incentives. The transformation plan's goal is to introduce a telemedicine video conferencing solution that will reduce cost overruns by improving PCH's value chain activity in the diagnosis and treatment of patients. Telemedicine was considered over other approaches and technologies such as RFID, ERP, and EHR. PCH is already leveraging ERP and EHR solutions. However, these solutions are not sufficiently innovative and only address traditional cost savings with regard to productivity and efficiency. The new healthcare model mandated by ACA requires us to look beyond current technologies to truly address future concerns. RFID offers potential cost savings, improves efficiencies, reduces errors, improves patient monitoring, and improves staff, patient, and asset workflow. It also reduces asset tracking errors, improves productivity, and is gaining popularity, particularly with the onset of the Internet of Things. RFID will likely become a widely used technology in the healthcare and hospital industry as costs continue to decline and government involvement increases. However, today the costs are high, the evaluation period is long, and there are privacy issues with the individual tags that need to be worked out as it pertains to HIPAA. Therefore, RFID is not the correct choice as it would not allow for quick wins and would actually increase overall costs for PCH in the short term. Video conferencing was proven successful for history reviews, certain physical examinations such as dermatology, psychiatric evaluations, and ophthalmology assessments, but is yet to be applied full-scale into routine hospital operations. PCH could become an early adopter with patient-to-doctor video conferencing appointments that will reduce overall hospital visits and operational and labor costs. VCDoc is the right transformation plan for PCH as it aligns with the company's strategy and allows for the same or comparable delivery of care as patients would receive through in-person visits. PCH could sustain its competitive position as a frontrunner by increasing entry barriers through VCDoc implementation while gaining additional capacity in preparation for the new ACA era. Achievement of the objectives outlined in the slide will substantially strengthen PCH's value chain through increased productivity, reduced cost, enhanced brand reputation, and improved health care. The workflow analysis illustrates an example of the efficiency gained when video conferencing is used versus a traditional in-person hospital visit. As shown in the illustration, once the appointment is made, the customer benefits by eliminating commute times, waiting times, and checkout times, all of which results in substantial time savings, not to mention the added convenience of being able to conduct the appointment from home, while on vacation, or any other convenient location. The hospital benefits by saving the necessary resources for pre- and post-diagnostic logistics involved with in-person visits. In addition, doctors become much more efficient by being able to diagnose and treat patients from a single video conferencing location. VCDoc will facilitate a secure video conference between a doctor and patient, primarily handling follow-up and consultation appointments. VCDoc will be compliant with HIPAA and other regulatory concerns to ensure client privacy and overall security of the VC sessions. The infrastructure required for the hospital and patients is a simple implementation. Workstations at the hospital will be outfitted with webcams and video conferencing application. The software will be a turnkey solution from a selected vendor responsible for SLA support. Network requirements include a VLAN for measurement and basic IT coverage similar to the desktop support the hospital utilizes today. Consideration for bandwidth needs to be assessed to offset any latency or packet loss with the video conferencing session. A vendor like VC, who uses a low bandwidth HD transmission, likely minimizes the requirements for extensive data pipe upgrades. The technology required on the client side requires compatible smart mobility devices capable of receiving and transmitting video. The application will be available for download from PCH's website or via an app store provider. Key stakeholder buy-in is critical in promoting the adoption of this technology because its success requires a company culture shift. Assigning influential doctors as project champions from the beginning will be critical for its adoption and long-term viability. PCH prides itself on its innovativeness and cutting-edge techniques and treatments that are pioneered via the hospital and research studies. It is because of this reason we feel Phoenix Children's Hospital is positioned well to be an early adopter and champion the benefits of video conferencing telemedicine. Further, there have been recent pilot programs that have reported early successes and benefits throughout the country with this technology. Marketing directly to the parents' concerns and reassuring them that the quality of care, convenience, and security of VCDoc will encourage adoption among these important stakeholders. The children, having been brought up in a digital world, should adapt quickly to VCDoc. Human resource requirements for the VCDoc project have been carefully outlined to ensure that the project is able to meet stated goals yet utilize PCH personnel efficiently. Current and future IT staff additions will handle the majority of the implementation aspects, including software deployment and post-project support. To gain acceptance among the primary users of the video conferencing technology, influential doctors will be appointed project champions. These champions will lead by example and help obtain buy-in among other doctors. HR personnel will provide the formal training that is required for doctors to use the technology. Finally, marketing will need to develop a targeted marketing campaign to spread public awareness of VCDoc to encourage PCH's patients to utilize this beneficial yet revenue-generating option. Careful budgetary consideration was given to the proposed VCDoc project. One of the benefits of VCDoc is its low cost, quick win appeal. Equipment costs are minimal and include licensing, webcams, and VC station setup. The phased implementation strategy over a 3-year period will allow PCH to generate revenue the first year, help offset implementation costs, and achieve a payback of the initial $310,000 investment by the 18th month. The premise of this technology is the efficiency gained through technology that will allow doctors to see their patients without physical requirements. On average, doctors in hospitals walk 6 miles per day. Assuming an average 15-minute per mile rate, this translates to about 1.5 hours per day. Through VC implementation and a target of 7 minutes per patient consultation, the doctors can leverage that 1.5 hour for video conferencing visits. We're assuming that doctors see on average 32 patients per day. Using just 1 hour at full VC efficiency of approximately 7 minutes, a doctor can see 8 patients within 1 hour, which translates to a 25% increase in capacity. This is a significant achievement because that additional capacity is achieved without the need for physical expansion or additional doctors. The increased capacity can be translated into additional revenue opportunity of between $156,000 to $936,000 per year. The revenue is based on a $40 revenue opportunity per VCDoc appointment and varies depending on the number of participating doctors and their VCDoc efficiency rates. Slow adoption and efficiency rates were assumed for a conservativeness approach. A cash flow analysis demonstrates that we can achieve positive cash flow in the 3rd year, which results in an internal rate of return of this project of 78%, assuming a 50% weighted average cost of capital. We use the balanced scorecard approach for creating and monitoring metrics to measure success. These metrics are not required in real time, thus reducing overall costs and complexity while delivering the right data at a reasonable time interval. Data quality assessment will be conducted to provide confidence that the data is correct, free of error, and timely. Much of the data will be retrieved from existing regulatory compliant database systems. These measures ensure that at no point will any data retrieved violate HIPAA or any related compliance framework. The data will be sanitized and will exclude patient information to protect patient privacy and keep the hospital in compliance. Additionally, the VCDoc project will be measured against the PM triangle of constraints, that is, time, scope, and budget. To summarize, we covered the industry overview and highlighted overall direction and challenges. Primarily, PCH needs to prepare for ACA and associated cost pressures. Via the company analysis, PCH should focus on its core strengths leveraged through innovative culture and continue to deliver on its strategy to be the premier pediatric hospital in the Southwest region. The hospital also needs to continue its cost focus to improve profitability, regardless of expansion or acquisitions. We introduced the VCDoc transformation plan, the technology plan, along with resource requirements, a benefit and cost analysis, and metrics for monitoring. With the onset of ACA and the increased patient demands and regulatory requirements placed upon PCH, implementation of the VCDoc solution is the right transformation initiative for PCH. It provides quick wins, increases customer satisfaction, aligns with company strategy, has a strong return on investment, is a low-cost initiative, has a quick payback period, and provides a low-cost alternative to increasing patient capacity.